And get started, and I'll just let people in as they come. Thank you for joining us for Family First Wednesday. April's presenter is RiverStone Health. I am Beth Ayers. I am the Montana's Peer Network Family Peer Support Lead. This is going to be recorded, so if anybody wants to watch it again, or there's somebody that couldn't be here, we'll have it up on our YouTube page, so Montana's Peer Network. So I will introduce, we have Crystal Kuka and Chris Hunter here from RiverStone, and they're going to talk to us about their array of programs, and then also including Kid Connect. So I will share my screen and then let them introduce themselves.
Hi. Oh, can you hear me?
Yep.
Okay. I'm Chris Hunter. I'm the Admin Services and Outreach Coordinator with our WIC and Family Health teams. And I'm here with Crystal Kuka.
Hi, everyone. I'm Crystal. I am a LCPC. I am one of the pediatric therapists here at RiverStone Health.
So thanks for having us today. Sam Miller, one of our nurse supervisors, may jump on at some point. She's in the clinic at the moment, so bear with us as we kind of go through this information. So thanks again for having us. We wanted to share about RiverStone Health Services in general, but we also wanted to touch on Kid Connect. It's a new title. It's kind of gathering everything that we do based on kiddos together. And it's really focused on providing that one-stop trauma-informed care. So you can go to the next slide, Beth. So all of our caregivers are trauma-informed. They understand how children are affected by trauma and then how to best help them heal. So all of our services here at RiverStone, we do accept Medicaid, Medicare, Healthy Montana Kids, and private insurance. We also offer sliding fee scales for those that do not have insurance.
I just wanted to add that we also have care managers here that help with if families have trouble with the insurance. I know the Medicaid thing's kind of a struggle right now. So we have care managers that help with that also, if families have questions or need help with that.
Yes, thanks, Crystal. We have our care managers that are based in the clinic, and then we also have home visiting care managers also, which we'll talk about that here in just a minute. So our clinic is open 6 days a week, open Monday through Thursday, 8 a.m. to 7 p.m., Friday 8 to 5, and then we do have a weekend clinic. We're open Saturdays from 9 to 1. So with prenatal and newborn care, really offering that family the best care that we can for a healthy pregnancy. So it's a multidisciplinary team. It starts in the clinic here, but then we also offer hospital services from delivery to postpartum care. And then we're also able to do all of our follow-ups at our various clinics here in Billings, Bridger, Joliet, and Worden. Next slide, Beth.
Oh,
thank you. So with our pediatric primary care, offer a variety of things for kiddos from birth through their teens and beyond, including those well child checks, any visits for illnesses, chronic disease management, injuries, sports physicals, and then immunizations as well. So we have our immunization team through public health that we partner with as well. Next, there we go.
So we do have 2 school-based health centers. One is at Orchard Elementary and the other is at Medicine Crow Middle School. And within those clinics, we have 1 nurse practitioner, 1 PA, 1 pediatrician that is there on Tuesdays and Thursdays. And then we have behavioral health services, which is myself at Orchard Elementary. And then Brandy McFerrin is at Medicine Crow Middle School. And we are there Monday through Thursday. And some of the benefits of having us there is helping them feel more connected, and us also helping families feel more connected, especially with some of the mental health diagnoses, and they don't have to, we're there at the school, so the kids can just come down when they need to, if they need to see medical, and then I just pull them from school, so parents don't have to miss work, and they can just come on down. And then it also improves the access to healthcare. In the clinics, we not only see the kids who are our patients, but we also see their families, siblings. We see kids within the school district too. We do see some kids from outlying areas also, but it's mainly school district too. Next slide. Oh, and we also have our nurse there who does, she's also there. So we, the behavioral health, we counseling for depression, anxiety, grief, trauma. We have been trained in different therapeutic modalities of trauma. We counsel patients and their families or siblings, suicide crisis interventions. Doing those assessments as needed. And we have a SMART room, which is SMART stands for sensory motor arousal regulation therapy. And it's here at the main clinic, but we're able to, if parents can come over here to the main clinic, we do use different tools at the school within the SMART room. And SMART therapy is for complex trauma, and it kind of helps with regulation, with attachment, and kind of work through their trauma with those ways. So next slide.
Do you want me to take that, Crystal?
Yeah, sure.
Okay, sounds good. So our complex pediatric care team really is focusing on those kiddos who may have developmental delays or behavioral concerns, and then just some specialized care, and especially for kiddos in foster care. Like Crystal mentioned before, we do have care managers throughout the organization who helped connect families to services, and this complex pediatric care team has a dedicated care manager, so she really works closely with them. Next slide. And in addition to our medical services within the clinic, there's also immunizations, pharmacy, and dental. So if a family doesn't have insurance, then we're going to look for ways to provide immunizations for that family. Our sliding fee scale also covers anybody in the pharmacy or dental, so they only would have to do that one time, and then it's throughout the organization that they could be covered. And now we're going to visit about some couple of service lines within our public health department. WIC is one of those. So it stands for Women, Infants, and Children. WIC is most well known for providing supplemental food benefits, but we also do a variety of other things, including nutrition education. We do breastfeeding support, connect families to resources, really wrapping that family up. We do screenings for mom and children, lead screenings, making sure that those are all within normal range, and working with them if they're not. So our WIC program serves families from Yellowstone, Stillwater, Carbon, and Muscle Shoals counties. So we have some of our staff that go out each month. We have remote services available, but we also have in-person services available. So they go out to those communities and meet with families there closer to their home. So we can enroll clients when they're pregnant. And if they're able to provide us proof of income, which, if that's Medicaid or copies of their pay stubs, and then a picture ID and a piece of mail to prove their residency, we're able to get them benefits on the very same day for those pregnant mamas, which is great. So we can get them going right away. And then we serve pregnant clients all the way up through kiddos through age 5. So our other service line that we're going to talk about is family health services, and this is our home visiting program. So we have a few programs within the family health team. Our first one is maternal child health. We're staffed with 2 nurses and a social worker. They really focus on that medical case management piece. So those pregnant mamas or kiddos up to the age of 18 who really need some extra support on coordinating appointments, understanding their diagnosis, any of those kind of a little more complex. We partner with the clinic. We see a lot of the same patients, but we also meet the family where they're at. So they do not have to receive their medical care through RiverStone for us to provide home visiting services. The only caveat with this is we can only serve families within Yellowstone County. So the following programs we're going to talk about are all Yellowstone County based. Next slide. There we go. Nurse Family Partnership, another one of our programs. It is a voluntary program. We serve pregnant clients and then stay with them through age 2, through their child's 2nd birthday. So we'll enroll them during pregnancy, see them every couple of weeks, support that client. We talk with them about having their own personal nurse. So lots of communication with that nurse, and again, support, education, lots of screenings. We're checking for depression and anxiety, intimate partner violence, making sure that they're connected to as many resources in town as they can. Next. Parents as Teachers is one of our other home visiting programs. We will enroll during pregnancy, and then that program, we can actually stay involved with them until the child turns 5. So a little bit longer program. And this one is staffed by parent educators, and we really work on that, engaging that parent and child in their interaction and really teaching the parent what that child is telling them through their actions and their words, and really working with that family unit. So for each appointment or home visit that they have, the parent educator takes an activity to have the parent do with the child. So they'll get down on the floor and they'll create something or explore something together. They also do group connections monthly, and so they really work to connect families of the various programs together, because we hear that a lot, that they just need more connection with one another. So this one in March was at the fire department. So it was really fun. They had parents and kiddos. They got to tour the fire department, try on stuff, ask all the questions, play with the stuff. So it was really fun. Next slide. Kids First is also based in Yellowstone County. This is our only program through Family Health that's not necessarily voluntary. We really, it is an expectation of placements with Child and Family Services when they have a child placed in their home, that they do meet with our nurse at least once. And our goal is to make sure that we're connecting them and getting them all of the information on this new child in their home. When this partnership was started back in 2016 between RiverStone and Child and Family Services, we were finding that licensed placements or even kinship placements, those family members had a child placed with them, but they didn't know a lot of their medical history. So maybe they didn't know that they had glasses, or they didn't know that they needed an inhaler for their asthma. And so they weren't getting those services. So we partnered with Child and Family Services and are able to really make sure that we're getting all of that information to the placement, and they're able to serve that child the best that they can. And again, this is where we will meet the family where they're at. So maybe this licensed placement takes their children to another medical facility in town. That's just fine. We will help make those appointments. We will visit with those providers, anything we can do to just make sure that kiddos are getting the care that they need. So we do medical, connect them to medical, dental, counseling, and vision services. We also work with those kiddos that are close to aging out. So those that are in the system and they're maybe 16, 17-year-olds and getting close to aging out of child and family services care. We work with them on making sure they know how to make a doctor's appointment and where their doctor is and what's an appropriate reason to go to the emergency room versus maybe an urgent care or calling their provider for information. Just empowering them to make sure that they have what they need. Next slide. So as we touched on before, we've got locations here at the main campus here down on 27th Street. Also Bridger, Joliet, Warden, Orchard, Madison Crow, and then we have the healthcare for the homeless site downtown as well. So it's lots of information. What questions can we answer?
I have one. Can you talk a little bit more about the healthcare for the homeless?
Yes. So that again is we will see anybody. We have medical services, and I cannot remember the address. I'm so sorry. It's Crystal, do you know the address by chance?
I will get that.
Thank you. So
I
it's,
have one of the addresses. It's 2424 St. Vincent de Paul.
thank you, Sam. Sam's with us now. She's one of the nurses in the clinic. Sam, do you want to take that, talk a little bit more about healthcare for the homeless?
Yeah, absolutely. I'm going to try to see if I can find the specific schedule because it is a little funky, but that location has a behavioral health services as well as 2 nurses, and then also has a provider. We're thankfully now back to having a provider there, I believe, each day of the week. So they're able to do pretty much anything. I mean, they can do labs, shots, wound care, care management services, medical appointments. The only things they really have to defer back to main clinic for would be like x-rays or some, special things like that they don't have on site, but they are able to do quite a bit. So that's just able to provide that care, right where those patients are at.
Thanks. What other questions do we have?
I have one. What's the best way to kind of go about receiving some of these services for our family members that are unaware of some of the services you guys provide?
Yeah, that's a great question. So medical services, they can just certainly call the main number and they can get them right into one of the folks that are going to get them right scheduled. For the home visiting services, I can send out our referral form, and it really has a lot of information that we benefit from prior to calling the family. And our biggest one is, does the family know that this referral's been sent to us? Sometimes that's a surprise to them and they're a little apprehensive, but so that's just good to know going in. So I'm happy to send that referral form to Beth, and then Beth, would you mind sharing?
Yeah, absolutely. I can do that.
I kind
And
of
then
have the
for
same
the-
question about this, about what Linnea just said, but about the smart room. So would the same process go for referrals for that to be utilized with the family? Like if we identify a need for that kind of therapy, do we do the same thing, just call and send the referral over?
So for us at the schools, you could just call the clinics, and I can give you the number. It's 247-3210. And then if it were here at the main clinic, they would have to be established patients with RiverStone Health in order to utilize behavioral health, which there is a therapist here that works too. But at the schools, they can be like a school district 2 student, and not necessarily have to be RiverStone Health patients, like in as their primary for behavioral health. So you
Okay.
could call there, or if they're already patients, then they can get established behavioral health here. And then we
Okay.
do have 3 pediatric therapists, and then we also partner with School District 2. It's called the Aware program that also has a therapist and a care manager too.
Awesome. Thank you.
I had another question on the Parents as Teachers program. You had mentioned that you can start when parents are pregnant. Can kids be referred to that and families be referred to that program if they're a little under the age of 5, but
Yes.
no longer pregnant? Okay.
Yeah, great question. And that's one of our programs. We have the ability to enroll them during pregnancy, although we don't see it quite as much. We usually see it once parents deliver, kind of that, early toddler stage is really when we start seeing kiddos come into that program. So that'll be on that same referral form.
Thank you.
Yeah, you bet. Other questions?
I have a couple more. Nobody else does. The school-based programs, are all of those free, or do they have to have insurance, Medicaid?
They do have to have insurance. Again, like Chris said, Medicaid, private insurance, Healthy Montana Kids, and then we do have the sliding fee
Okay.
scale also. I forgot to mention, I don't even know about our school clinics they do like well child checkups, urgent care, the dental team here will come into the classrooms at the school and give education, but the providers there also give the dental education. Then we have the behavioral health, and then we do sports physicals also at the schools.
Do you publicize those in-school clinics to like the other school district 2 schools?
Do you mean, what do you like?
Like if I had a kiddo that went to, I don't know,
like
Big
Newman?
Sky,
Okay.
and would they be aware, would families be aware that there are some in-school clinics?
So yeah, we try to get out pamphlets, and we try to go to all the like little like health fairs. But yeah, some parents don't know about that, don't know about us. But we try to get it out there.
I think that's the biggest challenge for any of these services, is that, you can be around forever and people still don't know.
Yeah. And
And
a
then-
lot of the families don't know that just because their kid is seen there, like they can be seen as well. And some aren't aware, like their families and siblings can also be seen at the schools.
And then the family health services, are those all free? The ones
They
that
are.
fall under that?
Yep.
Nice.
Yep. We're grant funded. And so the Nurse Family Partnership and Parents as Teachers have some criteria. Usually it's, Medicaid, SNAP, or TANF, and then some additional criteria. But then our maternal child health and Kids First, there's no criteria for maternal child health. Kids First, they have to be in foster care.
Okay. It looks
Kayla, did you have-
Sorry, go ahead.
Sorry, did you have a question, Kayla?
I did. Is the sliding scale posted on your guys' website? I just know there's a huge need right now because of all of the Medicaid, like them getting dropped. And so I know a lot of the families I work with, there's not, like they're just, a lot of their services have just had to like stop. And so I was just curious if that was something I could access and kind of give them a basis of like what it would cost, or
Sam, can I defer to you on that one? I don't know as much about the sliding fee scale.
Ooh, I do not have a ton of information on that either. That is Shari, our patient access specialist manager's kind of specialty, but I can definitely get some information from her and then send it in an email if that would be good, helpful.
okay. Yeah, just more out of curiosity, even if I just kind of gave them a gist of, like where they would fall on that, on that scale. So, okay.
And
Yeah.
nobody would ever be turned away regardless of their ability to pay. So we'll see clients no matter what.
Okay. Awesome.
And
Thank
we
you.
also have that good faith estimate in place as well. So we're able to kind of give that upfront information as well. But yeah, I'll definitely get a better outline of that and send it over.
Awesome. Thank you.
I did add the address for healthcare for the homeless in the chat. That is at that location, but they also are at St. Vincent's. I'm not sure the days on that either, or the hours.
Is the St. Vincent de Paul, is that what you're talking about there? Okay, drop-in center. Nice. And then it also looks like there was posted, Sam posted a schedule. I can't see it because it's really small, in the chat.
I can include that in the email as well. I know it's a lot crammed in there.
Perfect.
One other important thing I do want to throw out there too, because we just trained on this with the minor 8. Any visit for minors that's related to sexual health or substance use is a protected visit that would not go on a bill to the parents, and so they can access that care and those services without parental consent. So we've just had some instances where kids are trying to reach out from schools where we're not having our health center based in there, and in main clinic as well. So just trying to get the word out there in a safe way that we are a safe space for those things too.
That's great. And Taylor did send me over the Kids Connect brochure. Is that what it's called? And so I will send that out too to everybody here who's registered.
Perfect. It'll have all the programs that we talked about today are included on there.
Nice. How long have you had the Joliet, Bridger, and Borden sites?
As long as I've worked here.
Oh, really?
For and so at least more than 10 years.
Okay. I didn't realize that.
Sam, Crystal, do you guys know a better estimate?
I'm not sure, but that sounds about right. Because
I would also agree. I don't have an exact date.
That was just, I didn't know that. And how long have your in-school clinics been in?
I believe, I know Orchard was started probably in, let's see, I've been here 5 years, like 7, 8 years ago.
I think so.
Okay.
And it actually started partnership with Billings Clinic in the very beginning. But I'm not sure if Medicine Crow, I think hasn't been, I think Orchard was the first one.
Okay.
Do you guys have pretty, like, let's say we send a referral, and then for services to start, is there a long wait list with most of your guys' services? Or like, let's just say they needed like just primary care. Would that be something that are appointments like a month out, or are they, what's the flow of that?
So currently our goal is to have access 21 days or less for all of our providers. It kind of depends, some faculty who are covering MFMR have further out availability, but it is pretty nice. We do have a version of same day care every single day. So one way or another, we can usually get people into established care within 3 weeks.
Awesome. Okay. Thank you.
Yeah.
You guys might have already answered this. With the referral form, who do we send that to? Is it on the referral?
It is. Yeah, we
Okay.
have our fax information on there as well as an email for HIPAA compliant senders. We do ask that it be encrypted if it can. Otherwise, we can just have it be sent by fax.
Okay. And can any program or clinic or anyone put in that referral?
Yep, we'll take referrals from any source. Yep,
Okay.
self-refer. Yep, absolutely.
Okay.
Oh, Karen's on. Bridger Joliet and Warden started in 2007. Thank you, Karen.
Thank you, Karen. There any other questions? Well, I really appreciate you guys coming on. I know that I think I got the contact from Linnea and was just really surprised by all the services that you guys have and really kind of yeah, wish I had known that a long time ago, because I think a lot of the families that we work with can definitely, benefit from that. So thank you guys for all the info. I will send out the brochure and whatever else you guys email to me. I'll send that out to everybody.
Sounds great. Thanks so much for having us. It's always fun to share about what we do, and you can tell we're passionate about what we do and who we serve. So
Yeah,
thank you so
thank you
much.
guys. Appreciate it. All right, next month is May, and it is Yellowstone Boys and Girls Ranch, I believe, is going to come talk to us. Don't forget, you can sign up to be a free family member at Montana's Network. It just gets you connected to things like this, and then also just kind of a community of other parents and service providers with children with any sort of special health care need. And then we also have our Lifeline notebook available on our the website too, and that is a notebook designed designed by and for caregivers with children with special health care needs. And so the first half is just kind of a place where we can put all of our appointments and doctors and questions we're going to ask the doctors, and it's kind of all of that. And then the second half is more of a family self-care, because I think as parents, sometimes we forget to care for ourselves. So I think Kayla's, oh, I thought you were grabbing one. Oh,
I am. I was just going to kind of show. I was like, oh wait, they're right behind me. I can just show them right now. Yeah, there's lots of different pages for like when you get to the doctors and they're like, when did your kid have that procedure? And you're just like, I don't remember the date, or I don't remember the doctor's name, or we have pages for upcoming appointments, a look back, plan of care. So like a safety plans for the child and for the parents. Yeah, there's just a bunch of stuff in here. And then yeah, there's an actual, I like to say, like an actual self-care, practical self-care for parents with children with complex care needs. So yeah.
yeah. So Lene asked, how do we get copies? So if you want to purchase copies, they would be at mtpeernetwork.org. And that way you could hand them out to, the families that you're working with. If you come across a family that could really use it, just get a hold of us and we'll just put one in the mail for them. So
I have a quick question. So you're talking about YBGR presenting next month. So, and I missed the first part of this meeting, so I apologize. But are those monthly meetings where you guys are kind of sharing resources? And how do we sign up to be a part of those meetings?
If you just want to shoot me your email, maybe in the chat,
Okay.
And just so you know, once you get on my mailing list, you don't get off it. So, but
Perfect. I love it.
I send out the emails for Family First Wednesday every month, and then just anything else that could relate to people that take care of kiddos. I will put out there. Yes, let me look. I know we have May is, yes, Yellowstone Boys and Girls Ranch is going to come talk. June is Chinook Horses. And that's all that we have right now scheduled. And you can, we usually send out flyers for this, so feel free to print them out, email them to whoever you think would want to be a part of it. We're also beginning a support group for parents with kids with special healthcare needs. And so we'll also be putting that out there too, if there's any families that you know that could use that.
Okay, perfect.
Lots
I've
of
got a care manager that we're finally going to be able to dedicate truly to just pediatric specialty population. So I would love to get her kind of hooked in and be able to do some regular networking and stuff for that. So I will also
Absolutely.
to her.
Yes, and St. John's Cares program and MPN partnered up and did a quarterly social networking event where, yeah, we can all come together, talk about what we do, support each other, that kind of thing. And so the next one I will send out, we had the first one in February, so maybe June. We'll put that out too. So that was a really good way to get to kind of know people face to face that we can refer to. Well, yeah, definitely.
Beth, I'm
All right,
writing down your emails for you.
Thank you.
Just because they'll go away. Yeah.
They will, I know. Anything else? This meeting is being recorded. We will post it on our YouTube page after this. And yeah, I thank you guys for coming. Chris and Crystal and Sam, thank you for being here to present. These programs are amazing, and I'm really looking forward to referring families to them. So thank you guys. Everybody have a great rest of the day.
Thanks. See ya.
See ya.